For all verified facts, subscribe to our YouTube channel and click the bell icon to get the latest updates.
Hello and welcome to From the Front Lines. I'm Govindra Jaithiraj. The government has released an official protocol for using Ayurveda and yoga for protection against coronavirus or COVID-19 and treatment of patients with mild or no symptoms. Now, they include things that many people in the country might be familiar with, sipping hot turmeric milk, kada, yoga, of course, which I mentioned, and Yashwagandha and Guducchi, and there are 64 tablets in all. Now, the Indian Medical Association has taken exception to this and has asked the government whether there is enough evidence to back the support or endorsement of these medicines, and also if there is evidence in public domain which supports the release of these medicines, and has also asked, among other things, whether the government itself, which is the Ministry of Health, is actually using these medicines. So let's understand this a little better. The letter that's gone from the doctor side has gone from the Indian Medical Association, has been helmed by Dr. R V Asokan, who's the Honorary Secretary General of the Indian Medical Association. He is also a practicing general physician based in Kerala and has in the past served as Strategy and Technical Advisory Group for Tuberculosis at the World Health Organization, Geneva, for 2 years. Dr. Asokan, thank you very much for speaking with us. So firstly, what is your concern or problem with these new guidelines from the government on Ayurveda and yoga?
The concern is on behalf of the patients. It's not a concern of the medical profession alone. The point that we are making is that government can make protocols. It can be from any system of medicine. It should be supported by evidence. Any science has to have evidence. It has to be evidence-based. And it cannot be different for modern medicine and it cannot be different for Ayurveda. All systems have to come in the same level of inspection and scrutiny. So we personally feel the strength of evidence is important. For example, there was a huge discussion on the hydroxychloroquine, and it was transparent and in open. What were the side effects, what are the dose, what are the limitations, and why it is not being prescribed in the Western countries, why ICMR is propagating. So we need that sort of a transparency in data. That's exactly what we have.
Right. So the Union Minister for Health, Dr. Harshvardhan, who has released these guidelines, he says that these are in sync with ICMR or Indian Council for Medical Research and Council for Scientific and Industrial Research in India.
He himself has said this is empirical. If you read his statement, what this word empirical means is anecdotal. Or suppose I feel something is good, then I make it. I use it in my practice. This cannot be accepted for a national protocol. National protocol has to have two important scientific standards. One, it should be replicable anywhere in the world by a team which does not have a bias or any conflict of interest. Two, it should pass through a double-blind controlled study.
Right. Can you explain what a double-blind control study is? And I know that you've used this term in the past as well.
Yeah. To put it mildly, double-blind control study, the double-blind, that is the doctor who is using the medicine on the patient. And the patient is the second. The double-blind is both of them do not know what medicine is used. In a group which is being studied, both placebo or a dummy pill as well as the drug which is under investigation, they are used. Both the doctor doesn't know and the patient doesn't know whether it is a dummy pill or the drug which is being investigated. So at the end of a randomized, when the study is over, all these data is pulled together and then only it is unbiasedly taken, the call is taken whether the drug has been effective more than the placebo.
Right, and you also call it a prospective study. Why is that? And when you say an independent, prospective, double-blinded study, does that have any relevance?
Yeah. Prospective is from day one. It will start now. Retrospective is you go back and fiddle some data and then produce it. When I say prospective, they have to design a study where people have to participate from now or from tomorrow.
Right. So in this case, are you saying that drugs that we hear of, you mentioned hydroxychloroquine or dexamethasone or remdesivir, they've all gone through the similar prospective double-blind control studies?
Yes, absolutely. All drugs of modern medicine go through all these things. Then only the drug controller releases these things.
Right. So let me ask you, the same question from a slightly different angle. So is there any evidence that shows that some of these medicines that have been recommended in the Ayurvedic context particularly are bad, or have they done any harm or damage?
No, it's not question of questioning Ayurveda at all. It's a question of a drug being effective in COVID in relation to this particular illness. Even modern medicine drugs, people are saying that this is effective, this is not effective. But all these things come from studies. Thousands of studies have been published on COVID and other drugs across the world now. So that is how we have come to know that methylprednisolone is effective, that dexamethasone is effective. All these things have come from double-blind controlled studies. So we are not questioning the drugs at all. We are saying that in COVID, what is their relation? What is the study? What is the data?
Right, but if they are making a point about, let's say, immunity, and then you say that sipping hot turmeric milk, which many homes in India do in any case, let's say in anticipation of flu or other seasonal diseases, so is that? Would you have a problem with that too, or?
No, it's for them to bring the evidence, and especially in COVID. I think the layman has to understand a very particular thing. There are two stages. The first stage is the viral infection, the initial days. After that, there is a transitory phase where there is a quiet, nothing happens. After that, there is a hyperimmune reaction from the body. The whole complications of the body are due to the exaggerated immune reaction of the body. So here we have a status which is called a hyperimmune status, which is the immunity is killing the patient. So it is not a question of immune deficiency, it's a question of hyperimmune status. So this scientific principle has to be accepted, and it's well known. The Union Health Minister should have applied his mind, because he is a modern medicine doctor. He knows what a hyperimmune reaction is.
Right, but the wording here is more about addressing mild to no symptoms, which means that I'm assuming that you may be positive, or you may not even be positive. You may likely test positive later. So, this is, for instance, from what I can read, this is not saying that this is trying to cure an advanced stage, or let's say moderate to severe symptoms.
So, any disease can progress from mild to moderate to severe. How do you predict that this patient will not go to a severe illness? Today we know from day one, when you diagnose, steroids have to be started. Low molecular weight heparin, which is an anticoagulant, has to be started. There are two things which are happening. There is an acute lung injury, kidney injury, which is happening due to the immune reaction, which is an immunosuppression, not increasing the immunity, but decreasing the immunity by using steroids from day one. And this also causes clotting inside the blood vessels throughout the body. Anywhere it can cause, mainly in lungs. This clotting is the cause for all this morbidity and mortality. So we are using anticoagulants. Low molecular weight heparin is used.
Right, but this this is in consonance with, I think, what everyone would say, at least in modern medicine. But the sense I'm getting from the government's position is that all of this, in any case, at this stage, when you talk about, let's say, the government, the body fight, unleashing the immune system, or the immune system going haywire, or the cytokine storm, as it's known perhaps, that comes later. all of this is really to maybe try and even prevent it and keeping your immune system strong in a general immunity sense, and in immunity sense that we all know as normal citizens. If it goes beyond that, I'm assuming even the Ayurvedic proposition here would say that now you have to hand over to a regular doctor or a allopathic doctor. Am I right?
You want the complications to set in and then act. I will ask you a straight question. If you test positive, and would you wait for the cytokine storm to set in, or would you prevent it? There is enough evidence that steroids and low molecular weight heparin reduce the mortality in this case and the morbidity. We are seeing that even if they recover, had we not used steroids and low molecular weight heparin, they go in for pulmonary fibrosis, and their capacity to live and maybe the life expectancy also is going to go down.
Right. So, okay, let me then phrase that question differently. So, are you saying that if a patient tests positive, then this should not apply, but if a patient is not positive, which is regular life, the way we lead it, then some of these Ayurvedic medicines are okay?
See, then they have to bring the evidence that in COVID, that they are preventable, they produce a preventable effect. We are only asking for evidence. We are not degrading any system of medicine.
Right.
We are not used any word which is derogatory. We are asking for evidence because people ask for evidence from modern medicine. Then every system of medicine should bring evidence.
Right. So, Dr. Asokan, this is now almost 7 months up since the first cases started coming in. What's your sense as you look back? I mean, how much as a practitioner of modern medicine, how much sense or better sense do we have in terms of understanding the progression of this disease, and your advice to those who are watching to in terms of what kind of precautions they should be taking even at this point? Because after all, we have unlocked much more even in the last maybe 8 weeks or so.
The locking and unlocking have happened in the correct time. I think the role of the epidemiologists and the public health specialists, I think it is now at this stage of the epidemic is very limited. There is no longer need to flatten the curve or anything. Right now it is saving lives. It's in the hands of clinicians. In my opinion, even testing beyond a point has not produced any change or any materialistic change. For example, United States, has it reduced the mortality? Now the only point is we have to reduce the mortality. For reducing the mortality is the role of the clinicians. Even testing should be only on the demand of the clinician or the treating doctor, not on this scale.
Right. And your advice to everyone who is watching, I mean, how should they be, should they take any Ayurvedic medicine or not take? Should they be doing any kind of, generally, how do you keep yourself safe and reasonably, let's say, well protected in these times?
The only way to protect yourself is to have your proper wearing of the mask, because I find that many of them don't wear it on the nose, even when you talk. So that is one. The second is hand hygiene. Wash your hands with soap and water up to elbow, and more than 10 to 15 times a day. These are the only two known scientific evidence-based advice that can be given.
Right. Dr. Asokan, thank you so much for joining us and sharing your thoughts.